Hello, back again. This is Dr. Coring. How are you guys doing? I hope you guys are doing well. For those who do not know me, my name is Dr. Coring. I'm back again with another episode on Real Health Talk with Dr. Coring. I am an internist by training and trade, as well as a pharmacist by training and trade, who is now in a hematology oncology fellowship learning how to be an oncologist. And so it is my passion, as well as my desire, and also my pleasure to educate common folks as well as patients and caregivers such as yourself. And what am I educating you guys about? Essentially, wellness. How to stay healthy, how to maintain your health, and why is it important? And so that's why I launched this podcast to do just that. And so today we're going to talk about cancer screening. And so right now is September 30th, on the brink of October. So currently it is Prostate Cancer Awareness Month. And then tomorrow starts Breast Cancer Awareness Month. And I know the NFL right now is doing their annual cancer campaign, just basically showing and also educating, again, common folks such as yourself, all about being aware of cancer. And so, why? Why do we do this? Why is it important for us to, educate people about cancer awareness? Why is it important for us to essentially talk about these things? Why is the NFL spending money essentially for cancer awareness? Why do we have these Cancer Awareness Month? It's simple. Cancer is the second leading cause of death in our nation, next to heart disease. And, cancer essentially, like I just said, is killing people. And it's becoming more and more of a problem. And so, that being said, we like to screen for the most common cancers that's doing the most damage. And so, what I would like to do is talk about cancer screening. Why is it important? When do we screen for cancer? What cancers do we screen for? The common cause, in my opinion, of cancers, the most common cancers, and why our community, specifically the African American community, should be more aware, and how we should inspire and encourage our loved ones to get screened. All right, so let me throw out some numbers for you guys. The most common cancer that's diagnosed right now is breast cancer. The next common cancer that's diagnosed is lung cancer. And let me back up. Essentially, the most common cancer that's diagnosed is skin cancer. I should preference that. However, skin cancer is highly curable, all right? And so essentially, we almost ignore it because it's so curable. And so I should say that. And then now the next common cancer that's diagnosed is breast cancer. Next to breast is lung. And then next to lung is colon cancer. All right. And then prostate cancer. And then all the other cancers. All right. So that's the hierarchy as far as common cancers being diagnosed that we really, really worry about: breast, lung, colon, prostate. Okay. And what are the cancers that are causing damage, though? The cancers that are killing people. So the most deadliest cancer in our country by far is lung cancer. All right. Then colon cancer does the next damage. After that, we have gastrointestinal cancers such as liver, stomach cancers, although rare as far as being diagnosed, and then breast. After breast, pancreatic cancer is pretty deadly. But good news, it's not all that common. And so, what am I trying to say? What I'm trying to say is these cancers, I just list them, are common and are deadly. Specifically, the lung, colon cancer, breast cancer. And so, therefore, we like to screen for these simply because in my world, in the cancer world, the earlier we detect and diagnose the cancer, the better the outcomes. And so that's why we really, really try to encourage patients to do a good job with being on top of screening for these cancers, essentially because it saved lives. As mentioned earlier, we can diagnose these cancers, the better the outcomes. All right, so which brings me to the next point. What cancers do we screen for? And so we typically try to screen for the cancers that are one, deadly, that are two, common, and also that are three, asymptomatic when essentially not when diagnosed, because sometimes we diagnose cancers late, but typically asymptomatic before they spread or metastasize. And what's dangerous about cancers that don't cause symptoms as soon as you acquire it is by the time you have the symptoms, it's almost too late. The cancer have now spread to other organs. And once cancers spread to other organs, they are generally and typically incurable. Okay? And so the thing is, we try to do a good job detecting and diagnosing these deadly cancers while they're curable, while they're still in the curable state. And what does that mean? It means that we try to catch and diagnose and detect these cancers when we still can give you a good outcome, a great quality of life. And so screening is the absolute best way, the absolute best method we have right now in our arsenal to detect these cancers when they're still in its infancy, early stage. Why? It's because that gives us the best opportunity to give you, the patient, the absolute best outcome. And that's what my job and my colleagues' job is all about, trying to give patients the best outcomes. Okay? And so that brings me to the next point. What cancers do we screen for? All right? So it's breast cancer. All right? If you're a woman, we screen for breast cancer, cervical cancer, and lung cancer. And it's an asterisk beside lung cancer simply because we only screen for lung cancer if you have a strong smoking history. Okay? And so if you are, or if you do not have a strong smoking history, then, we typically do not screen for lung cancer. But definitely, if you're a woman, breast, cervical, colon cancer. And I may not have mentioned colon cancer earlier, but yeah, a woman, breast, cervical, colon cancer, and lung cancer if you have a strong smoking history. Now let's go to the man. For men, we screen for colon cancer, prostate cancer, and lung cancer. Same for women. We only screen for lung cancer for a man and for a woman, for that matter, only if you have a strong smoking history. And what does that mean, Dr. Coring? Strong smoking history, 20-pack year history, meaning you've been smoking 1 pack of cigarettes per day for 20 years. All right? And so that's what that means. And so it brings me to the next question or topic I would like to discuss is what age? What age do we start screening for these cancers? Typically for breast cancer, especially if you're an African American woman, it's very wise now to start talking to your primary care physician at the age of 40 about screening for breast cancer, okay? If you're a woman, cervical cancer screening starts at age 21, all right? Colon cancer screening, especially if you're African American and have a strong family history of colon cancer, 45. If you're not, maybe 50. Okay? Strong smoking history, 20-pack year history. That means 1 pack a day for at least 20 years. Man or woman, we generally start screening for lung cancer at age 50. All right? Prostate cancer. If you're African American, especially if you have a strong family history of prostate cancer, the range is between 40 and 45. We want to start screening for prostate cancer. If you do not fit the description, you're not African American, do not have a strong family history of prostate cancer, age 50 seems to be reasonable. Okay, and so my next topic I would like to discuss is how do we screen for these cancers? So breast cancer, we typically do a mammogram. Cervical cancer, we do a Pap smear. Colon cancer, colorectal cancer, we do a colonoscopy. That's the gold standard. Now, there are now different multiple ways we can screen for colon cancer other than colonoscopy. We could test DNA on a stool sample. We could test for blood on a stool sample. But the absolute gold standard and what I recommend to my patients is a colonoscopy. Okay, the reason why is because with the colonoscopy, we can actually diagnose the cancer at the same time, and also if things are normal at that initial screening, you don't have to get screened again for 10 years. However, if you do we call it poop on a card screening, meaning you poop or you get a sample of poop on an actual card, send it in the mail, testing for blood or DNA, you have to do that every year. And so that could be inconvenient. And so that's why I believe colonoscopy, I should say, is the absolute gold standard for colon cancer screening. How do we screen for lung cancer? Low dose CT scan. What does that mean? We basically use low dose radiation, send you through a CT scan your lungs, and we assess for nodules and mass. And we're able to basically do a radiological assessment to see if any nodules or lesions or mass within the lung field looks concerning for cancer. And then lastly, how do we screen for prostate cancer? PSA, which is a blood sample. PSA stands for prostate specific antigen. And we measure that by just doing a simple blood sample. All right. And so that's our methods of screening. What are the causes? Why do we have so much cancer in this country? Big question. My opinion, food. Simple, in my opinion. Food, fast food, McDonald's. And, I guess, I don't know if there's any penalties for saying that, and I should back that up. There's no evidence. There's no scientific evidence suggesting that McDonald's causes cancer. So please, let me preference that. But what I'm suggesting is processed foods, such as fast foods, can contribute, in my opinion, to cancer or the cancer incidence that we're having. But there's other causes. Pollution, obviously smoking, we talked about that, alcohol as well. So environmental lifestyles can be a contributor as well. And also genetic reasons. Some cancers are there. It's just, a matter of our genes. But there are some things we can do as far as how we live. We can modify our lifestyle to help reduce and also mitigate the risk for cancer. And so I would like for us to encourage our community, our brothers, our sisters, our cousins, our friends. Let's eat more fresh food if we can. I know it's not cheap. I know salad is expensive. It's crazy. A salad is about $10 where you could go to Mickey D's, McDonald's, and you could get 2 meals. Well, probably not 2 meals, but you see my point. You could actually feed, I don't know, maybe 2 people with $10. I don't know. I haven't been to McDonald's in a while. But my point is, $10 will go a lot further at a fast food restaurant versus eating healthy. And so what my point I'm trying to make is eating healthy is not cheap. But if we can, let's cook more. Let's utilize and eat more fresh foods. Exercise. Obesity is a contributor to cancer. So we need to exercise. Let's try to stop smoking. All right? Especially tobacco, nicotine products. Let's try to stop doing that because that's a contributor to lung cancer and other cancers as well. And also stress. I think stress puts our body in a constant inflamed, reactive state. And I think that's contributing to our cancer as well. And I know that's easier said than done. We got bills we have to pay. We have kids. We have spouses. We have life. We have work. All of this stuff can stress us out. Okay, guys, what am I trying to say? Overall, cancer is a problem in our country and globally, worldwide. It's the second leading cause of death. And we have methods to mitigate that by screening for cancer. The earlier we catch the cancer, the better the outcomes. And so, what I'm trying to encourage you guys is to talk to your primary care providers to make sure that you're up to date on your breast cancer screening, your cervical cancer screening, your lung cancer screening, if you are a heavy smoker, your colon cancer screening, and your prostate cancer screening. And lastly, encourage your brother, your sister, your spouse, your kid, your loved one, your nanny, anybody that you know, to get their cancer screening done. It's very important. It saves lives. It honestly saves lives. All right. I love you guys. That's my time. Peace and love. Talk to you next time.